Senator Moody.
Thank you. Minister Saks, thank you for being here today and for the crucial work that you're doing on behalf of the Canadian. My question is on mental health care for children. Not surprisingly, according to the Mental Health Commission of Canada, 70% of persons living with a mental illness experience symptoms in their childhood and adolescence. They estimate that 20% of children and youth in Canada are affected by mental health issues today. That's about 1.2 million children. Minister, how are you working with the provinces to meaningfully increase access to mental health services for children in communities throughout our country?
Madame la Ministre.
Thank you, Minister. Question, and I agree with you wholeheartedly, Senator. When it comes to creating foundational supports for our children, it comes with mental health and resiliency, and that should be a top priority, not just only through our healthcare systems, but through our education systems, community services, and so much more. But that being said, as I mentioned previously, the $25 billion over 10 years, which is part of our bilateral agreements, will be a key component to that, ensuring that through family health practitioners, that children will receive frontline support where they need it most in coordination with their families. But in addition, through the Suicide Helpline 988, we have put significant funding and supports to Kids Help Phone, understanding that kids need to be met how they need it and when they need it, and the privacy and safety that they deserve.
Senator Moody.
When I speak to young people, Minister Saks, I hear that wait times and struggles to even see a professional mental health physician unless they are at a critical point. I think you would agree, Minister, that prevention is better than treatment, and our goal should be to treat mental illness as soon as possible. One important challenge, frankly, is navigating this complex system and accessing services before it's too late. Minister, what are you doing to help families navigate systems to find services before the worst happens?
Madame la Ministre.
Thank you. Minister, one of the first priorities that we've been doing is, as we begin the phase out of the Wellness Together program, is to ensure that we have a full directory of services of where to help Canadians reach access immediately in their jurisdictions. But in addition, I will say we're in a unique time of mental health where I have counterparts in nearly every province and territory. We work together and meet quarterly on best practices and models. We recently shared the Mental Health Day Hospital model from Nova Scotia, which has shown terrific success in meeting individuals with quick psychiatric assessments and referrals to where they need to get help, and other provinces are interested in following suit.